Hey everyone. Okay, I love data and I love trying to parse through and like make up things that I think about data. But sometimes it's nice to have some actual data, especially if you're kind of like, okay, I'm going to start this DPC practice and I don't know how busy it's going to be or what the demand is going to be on a daily and weekly basis of my time. And so I just wanted to go through really quickly. This is our text message and phone call frequency over the past 3 weeks. Now, there was a New Year's in there, so you'll see, like, just going to use this little red ball to kind of highlight what I'm talking about. This was New Year's Eve, this was New Year's Day, so not a lot of messages those 2 days. But these 2 weeks, so this is Monday, Tuesday, Wednesday, Thursday, Friday, Monday, Tuesday, Wednesday, Thursday, Friday, are pretty representative of what we get on a regular basis. These are unique people. So this isn't the total number of messages, but the total number of unique people that reached out to us. Now, we're a pediatric direct primary care practice. We have about 560 patients. We've been open for 2 years now, and you can see the volumes that we see. So this is Monday. Mondays are certainly the busiest day of the week for us, and you can see that represented here with text messages, and over the course of the week, things usually get less and less. So on this past Monday, January 15th, we had 45 different people text message us. And then Tuesday we had 34. And then the next day we had 34, and then 30, and then 29. And it just drops off from there. You can also see the number of phone calls, which is much less because we actively encourage people not to call us by instead text messaging us. And you can see how those drop off over the course of the week too. I think this kind of gives you a flair for, so okay, we have 45 messages, we have 500 patients, so that's a little bit less than 1% of our patients needing something on any given day. So as your practice grows, you can think, okay, it'll probably be around 1% of my practice that needs anything on any given day when it comes to messages or phone calls. Now, when it comes to visits, with 560 patients, we probably do between 7 and 12 visits per day, depending on this is sick season, so obviously this time of year is a little bit more busy. And so that looks like 7 to 12 sick patients or sick visits on a day. Actually, not sick visits, just total visits, including checkups. So about 7 to 12 visits on a day-to-day basis at our size. And so hopefully that just gives you a little bit of information about the frequency of texting. You can see over the 3 weeks is pretty consistently between 30 and 40 text messages per day, with it trailing off over the course of the week. And so hopefully that just gives you a little bit of a sense, and I'd be curious what other people see in their practices in the terms of volumes. This was all, so we use Spruce, and this was all generated by Spruce to give us this information. It also tells us the total number of text messages exchanged. Let me pull that. Okay, so here's the total number of text messages sent. Bring to front. Over the course of the past week. So the green are outbound ones that we sent, the blue are inbound. Now some of these are automated because after hours they all get that automated message. If they text us, it says, hey, we're not open right now, that sort of thing. And so some of these are automated, but this overall trends and fits with what we typically see, which is about 300 messages back and forth on a Monday, and then about 200 on a Tuesday, and then a little around 150 on a Wednesday. Or actually, don't watch my math. I'm doing terrible with math right now. This is about how many text messages we get per day back and forth. So every patient texts us, and then it's 1 or 2 text messages back and forth to deal with whatever issue that they're facing. And so that's how we get to these numbers of text messages per day. Hopefully that helps. Take care.